Hello, I'm Dr. Dennis McKenna. I'm joined today by Dr. Jason Mouzakis. Jason, great to have you here.
Great to be here, Dennis.
Okay, today's Friday, March 1st, giving you the update from Albany Med. All right, first things first, Jason, you did not get the memo on the tie.
I didn't, clearly.
Everybody
I'm
knows,
underdressed today.
Everybody knows I wear a tie every single video.
I was looking back at old
Yeah.
videos, and
Okay.
you faked me out.
Jason, we have a bunch of topics to talk about, but before we do, I think this is the second or third time I think you've done this video with
Correct.
us. I think it'd be great just to spend a moment and remind people who you are and your role here. Jason currently serving the role of Hospital General Director, doing a fabulous job here.
Thank
For
you.
those that don't know what that means, he runs the hospital, and you've been doing it since the first week of December last
That's
year.
right.
Importantly, Jason is a graduate of Albany Medical College, class of '95. So as I was kind of leaving, you were coming in. And I think most people know Jason has an extraordinary reputation as a pediatric otolaryngologist. So operates on children and adolescents with ear, nose, and throat problems. And probably, how many people do you think you've operated on in your years here?
I tried to figure this out, and over the years, it approaches about 40,000 procedures.
Incredible.
So
Incredible.
it's been a great experience.
Yeah, okay. So before we talk on other topics, spend a moment, because I know you're very proud of your team. You're somebody as a leader, you talk a lot about teamwork. I think you have a series of direct reports. Chief Medical Officer?
Dan Pausay. And just before I get into the entire roster, I want to really thank Dr. McKenna because I inherited an amazing team of direct reports. And Dan is our Chief Medical Officer, and he really has a finger on the pulse of what's going on with our medical staff. His wheelhouse is communication. He does a fabulous job of connecting with all of our staff, and I appreciate his work.
Great. Chief Nursing Officer?
Kevin Zhang. Kevin, his strength is he is an analytics guy. He is wonderful. He's a great communicator. He really connects, and he's most proud of his nursing career, that he himself is a nurse practitioner, and we're really proud to have him on the team.
You're Senior Vice President for Diagnostic and Therapeutic Services.
JD, John DiPaolo, and he really is my right-hand person when it comes to understanding all the services that we provide on a daily basis, has a real handle on the local knowledge that we really need to run a hospital.
Chief Logistics Officer?
Ashley Taliski, and Ashley has really led the charge with logistics. It is a comprehensive way that we can see throughput in our hospital. Appreciate all that she does.
And Perioperative Services?
Sean Roddy. And Sean is also so valuable to me and connects me to the perioperative space, especially as we look forward to his role in helping our utilization on our campuses.
And perhaps most importantly, your Executive Admin?
Maria Brett. Right. Maria is my brains of the operation.
Right.
She really helps me to where I need to be. So I wish her well. She was out today ill, and I hope she feels better soon because I feel an absence in my heart when she's not here, that's for sure.
Yeah, we feel the same way when our executive admins are not there. So that's your team. They're working very hard. A lot of focus on what we're going to talk about near the end, which is Epic. So just for run a show here, we're going to talk about some notable firsts here at Albany Med in the hospital, okay? Then we're going to talk about ways that people both internally and externally can recognize the great work done here, and then we're going to talk about Epic, all right?
Awesome.
So Jason, there's been a couple notable firsts here recently. Up in the cath lab, recently we did the first catheter-based pulmonary valve procedure, and it's important because this individual had a procedure done in a certain way, but they avoided something else.
Yeah, so this is a child who's now a teen and had a condition, a congenital heart condition called tetralogy of Fallot, and it's a complex situation where the blood flow doesn't flow well in the heart. This replacement, this valve repair, if you will, allowed this to be done without an open surgery. So the recovery was very fast, and it was a first in our region, which is really impressive. So it rivals the work that's being done at major hubs such as Boston and New York. Puts us really on the map.
For sure, and we credit the entire team up there. Obviously, as you can imagine, it's a lot of different people in a lot of different disciplines doing this type of procedure.
That's right.
And then before we talk about the next one, importantly, this is what Albany Med does, right? Academic medical center, we take care of all sorts of things, whatever comes in the door, but often the first to do these very specific procedures, which allow people to do care locally, and as you say, not have to go to New York City or Boston. So here's another one, a gentleman with COPD, emphysema, lung disease. He's dependent on oxygen. He can't leave the house without oxygen. He often talks about how he can't drive. His entire life was wrapped around, with he and his wife, all that coordination. A very specific procedure done here by Dr. Medici, interventional pulmonologist, probably the only hospital around here that has that type of thing. Endobronchial valve placement, incredible.
That's right. So these are valves that are inserted into the endobronchial or inner part of the lung passageway to allow him to breathe in and out very comfortably. Life-changing. The Zephyr valve, Zephyr, by the way,
Right.
a little interesting tidbit. It's a word that means gentle breeze.
Okay.
So he's able to breathe again, and good for him.
Yeah, for sure. This is definitely a new release on life for him. Once again, credit not only to the physician who did the procedure, but the entire care team around them that made that happen. So congratulations to both of those individuals. So as we talked about, very special care takes place here. Very special care takes place really throughout the system. Today's the last day that you can vote. We hope you voted before. Even if you have, you can again. This is the best of the capital region, Times Union. You can vote for best hospital. Certainly we have that. 3 different urgent cares that you can vote for. And interestingly, this year for the first time, best daycare. Best daycare.
Outstanding.
So lots of ways that you can go online and vote for the best of capital region, representing the Albany Med Health System, representing the care taking place in our hospitals as well as in our off-site locations.
Outstanding.
And I voted. I'm sure you voted.
Absolutely.
And,
multiple times we
yeah,
can vote.
you can vote, and that's legal. That's what they want people to do.
Exactly.
In addition to that, as Times Union does every year, salute the nurses, and this normally takes place in March. The final date is March 6th, and we hope that you would go online now. If inside Albany Med, intranet, external, go to the Times Union website and recognize one or more of the nurses that make this place very special here. And every year we have nurses, multiple nurses from Albany Med who've been recognized as the Salute to Nurses for the Times Union.
And maybe a chance to salute our wives.
For
Your
sure.
wife and my wife, both nurses.
For sure, for sure. All right, very good. So please recognize both the Times Union sites, and let's vote early and often. All right, now let's transition over. Epic. It's happening.
I'm excited.
It's happening, okay? So let's remind ourselves, Care One, we talk about that, it has 3 component parts. First of it was bring to standard. That was infrastructure and cybersecurity preparedness across the whole health system. Next was putting in our ERP, our enterprise resource planning. That was Workday. We did that last July. Now we're rolling forward with our electronic medical record, Epic, taking 12, 14 disparate medical records, electronic and paper processes, and bringing them all together into one singular platform for the system. First step, Albany campus this weekend. Jason, you're right in the middle of the eye of the storm. Tell us what's happening.
I absolutely know this is going to be game-changing for us. When I think about what Epic will do for us, I have to frame it in our tripartite mission. So when you think about our clinical mission, educational, and research missions, it really is that synergy that we see in Epic. So I'll take a moment to talk about clinical. This is going to be so impactful for our patients, really enhancing our patient care. I'll share a small anecdote. My dad got on his MyChart portal. He's 77 years old. Hi, Dad. And was able to easily navigate the system. Very proud. He's suffering from prostate cancer, doing well, but was able to look back at his records, and he was really impressed at how he was able to see that in a very facile way. So I'm really glad for our patients to have that connectivity.
And that MyChart is the patient portal.
Correct.
And ultimately, as we go live throughout the rest of the health system, all of that information will reside in one location.
That's right.
Right? So they can download the MyChart portal and have access to their information.
That's right.
Right.
Secondly, I want to talk about a little bit about our science and research, if you will, because if you think about it, even as clinicians and all the great people that make our center such an important place, we really base our work on science. And when you think about what Epic allows you to do is to study your outcomes, to enhance our care delivery. I've played with the slicer dicer function. So as clinicians, we can look at, let's say I'm a doctor studying how effective am I with my patients with blood glucose levels. I can grab a demographic, I can look at it over time. Maybe I've changed my strategy for these patients. Wonderful.
Right. And then, Jason, as we go into the weekend, we know that people are going to be working around the clock. We know we're going to cut over sometime between Friday night and Saturday morning. We'll be in a downtime period, and then we'll light it up. What would be your advice to people who are going to be working here this weekend as far as what it's going to be like to go through this very significant change in change management? There must be a couple bits of advice you'd like to give them.
Absolutely. Expect there to be some trouble spots. It's going to be a little bit challenging, but most importantly, the word that I think of is grace. Have grace with yourself. Have grace with the people around you. We'll get through this together, and we'll lock arms, and we'll have so much support during this Go Live weekend. We will have experts at the elbow helping us at all times. We have a group from Epic that are here and ready to support us. So support is going to be key, but I think keep calm and keep a cool head. That's going to be so critical to deliver this excellent product.
Yeah, and let's remind ourselves, this is ultimately when people hear electronic medical record, they think medical, they think clinical, a huge component part of it. But it's also revenue cycle, it's our access team. In fact, you and I both know 2 weekends ago, there were hundreds of people throughout the health system coming in on the weekend, getting all the registration, all the appointments, all the scheduling ready to go. It absolutely has been a full team effort, and I think on the back end of this, we're going to say this was the most singular, transformative thing we've done as a health system probably in 10 years. This is a big thing, and we are prepared.
Absolutely. And,
Yeah.
and one last point about the Go Live phrasing. We're all excited, and it feels very final, but it's been brought up in many circles. I think it's a real Go Live commencement of Epic.
That's right.
And really, this is the start of something tremendous and great. So
Yeah.
be patient with the system. We're going to work through, optimize it throughout.
All right, couldn't have said it better, so we'll leave it at that. Jason, it's great to have you here.
Great to be
I know I'll be seeing you this weekend. We'll be here all weekend, day, night,
I'll
evening,
wear a
weekend.
tie.
You wear a tie, I won't wear one. I can, I can guarantee you I will not be wearing a tie this weekend. So we'll be seeing you on the floors. And typically we do a video now about every 2 weeks, but I think we may come back earlier, check in maybe next week, and update you on how things are going. So we look forward to seeing you next week. That's it. Thank you, Jason, for being here.
Thank you, Dennis.
We ask that you once again, please take care of yourself, take care of each other, and we'll see you soon.